Thank you, and thank you for the opportunity to present our work. And I'd like to acknowledge my other co-authors, especially the first three who were responsible for data collection. I have no disclosures. So we've shown previously that nocturnal Luts are predictive of poor health. They're on the causal pathway of frailty, and we also know that they're associated with an increased length of hospital stay and higher medical costs. A bit sadly, and especially coming from a geriatrician, the people in this setting, these symptoms are very poorly detected, investigated, and rarely actually treated. And to our knowledge, there's no data on the prevalence of these symptoms in this particular patient population. So our aim was to describe the prevalence and incidence of nocturnal Luts in a tertiary hospital subacute aged care environment. We had our registrars administer a short questionnaire that looked at the variables that are highlighted in blue here, which include the different nocturnal Luts, but also daytime symptoms, previous history of bladder symptoms, age and gender. And we are looking at 150 patients accrued over about a 7-month period. So, I would have to hasten to add that this is not an epidemiological study. It's a snapshot using an audit process. So it's not that scientific, if you like. So we found that there, in our patient population, there were 52 males with a mean age of 83. And in the main, it was a frail, comorbid population of people with impaired mobility. The vast majority had come to our subacute ward from our acute care sector, where they'd had an average length of stay of about 1 week. 44% had a prior history of lower unit tract symptoms, and in this patient population, however, 50% had daytime symptoms. So clearly there had been the new development of symptoms in perhaps a significant number of patients. And almost 80% of people had one of these stated nocturnal lower unit tract symptoms. If you look at the data here more carefully, you can see that all nocturnal lower unit tract symptoms are significantly more common in patients who have a history of prior symptoms. I would say, not surprisingly. But if you look at the people who have had, who did not have lower unit tract symptoms before, we've got a 65% incidence of nocturia. So that's a fairly significant development, I think. In those patients who had nocturnal urgency, urgent incontinence or enuresis, then you can see there's an extremely high association with nocturia. And that begs the question, perhaps, is nocturia a driver of other nocturnal lower unit tract symptoms? There was an average of about 1.9 of the individual lower unit tract symptoms in the patient population, with no difference by gender and no association with age. If you look at the number of lower unit tract symptoms and also the individual lower unit tract symptoms, there was a clear correlation with those patients who had diurnal symptoms and also those who had had pre-existing symptoms prior to admission. So our conclusion is that nocturnal lower unit tract symptoms are in older inpatients are highly prevalent, and interestingly also there was a fairly significant new incidence of nocturia in this patient group, and raises the question whether they may be readily modifiable if we were to investigate them a bit more carefully. And screening for daytime symptoms is highly suggestive that they'll also have nocturnal symptoms, again, not surprisingly, but as far as we know, this is new data. So in this population that we would say is poorly investigated and treated, we think a formal prevalence study is warranted, and we would intend to look at other aspects of bladder history. Certainly some of these symptoms suggest that the bladder is a component, but that's not all that we know happens in those with nocturia. And we'll be looking to collect in hospital and different variables in the hospital environment and hospital practice, which may actually have a significant bearing on the symptom presentation here. We'll be keen to look at comorbidities and also maybe even the natural history after people leave the hospital, most of whom go home. Thank you. Happy for questions.
The floor is now open for questions. Kathleen Hunter, University of Alberta. It's more of a comment. Thank you. This is really interesting work. I have a great interest in hospital care for older people. I would encourage you to, moving forward, to look at documentation, especially on histories in acute care. There are a few older studies, including my very old dissertation, but other authors as well, that have done some audits of charts in hospital that suggest that this information is not gathered on this population who have a very high incidence of Luts, and nocturia being one of them.
We would concur with that, very, very much so. And that posed a difficulty in actually us getting the data, because it's not necessarily reliably obtained by charts or indeed the nursing staff.
Shachi Tiagi with University of Pittsburgh. Thank you for this study. It was very interesting. Just a quick question. Were you able to collect, or do you have any data about these patients with increased nocturnal urinary symptoms and falls? Though we know that there are a lot of fall precautions that are instituted in hospitals, but did these nocturnal symptoms were associated with increased fall risk in these patients?
So no, we didn't collect that data. This is really just a snapshot on prevalence to allow us also, I mean, I think we've confirmed what we thought, but we now wish to go forward and look at all that sort of data, yes.
Okay, thank you very much. We will now move on to the next presenter.